Okay, so this is section 4.5 on teamwork. The objective is to identify why teamwork is beneficial in healthcare. In almost any healthcare career, you will be a part of an interdisciplinary healthcare team. The team concept was created to provide quality, holistic healthcare to every patient. Teamwork consists of many professionals with different levels of education, ideas, backgrounds, and interests, working together for the benefit of the patient. A surgical team can consist of 10 to 15 people. When the team works together, the patient receives quality care. The teamwork also improves communication and continuity of care for the patient. When there is teamwork, the patient knows his or her caregivers and support staff. All team members help to identify the needs of the patient, offer opinions on the best type of care, participate as decisions are made on options of care, and suggest additional professionals who might be able to assist with specific needs. Teamwork allows the patient to become more educated about healthcare options and make informed decisions regarding treatment and care. Every person on the team must understand the role of each team member and that each team member is important on the team. Knowledge provides a picture of the patient's total care plan. It helps to clarify each person's responsibility and establishes the goals that the team wants to achieve. Most teams have frequent patient care conferences, and the patient may be an active participant. Opinions are shared, options are discussed, decisions are made, and goals are established. Each team member must listen, be honest, express an opinion, and be willing to try different solutions. When I did my clinicals at Mary Free Hospital, they would have team meetings each week with the doctor. Usually the patient was involved, or it wasn't, I don't think it was every week, but the doctor, the patient, and sometimes their family members, and then each member on that person's team. And they would discuss what was going on with their medical care and their therapy and how they were progressing and what goals were were going to be made. And then in home care, we had team staff meetings. For a while, it was every week, and then it got to every other week. And again, patients were discussed during that time, any issues or problems that patients were having, or anything that needed to be discussed among the team regarding that patient was discussed at that time. A leader is an important part of any team. They are responsible for organizing and coordinating the team's activities, encouraging everyone to share ideas and give opinions, motivating all team members to work toward established goals, assisting with problems, monitoring the progress of the team, and providing reports and feedback to all team members on the effectiveness of the team. We're going to talk about leadership more. A good leader will allow others to assume the leadership role when circumstances indicate that another person can handle a particular situation more effectively. So that good leader will realize when another team member would make a good leader also and give that responsibility to that team member. Good interpersonal relationships are essential on the team. Of course, poor interpersonal relationships among team members can harm the quality of care and prevent the team from meeting its goals. They may not work well together. They may argue during team meetings or whatever. And hopefully this is not the case, but you certainly don't want team members bad-mouthing each other to either other team members or even to the patient. Of course, good interpersonal relationships can improve the quality of care. Members of a team will have different cultural and ethnic backgrounds, genders, ages, socioeconomic statuses, lifestyle preferences, beliefs, and levels of education. And all of this helps teams to be even better when there's a variety of team members on it. Each team member must understand that these differences affect the way a person thinks and acts. They must be sensitive to the hopes, feelings, and needs of other team members. The golden rule of treat others as you would want to be treated should be the main rule of teamwork. In order to help develop good interpersonal relationships, you should follow the personal characteristics of a healthcare worker. Conflict among individuals with different personalities is a problem that can occur. It is essential for each person to deal with the conflict in a positive way. People involved should meet, talk with each other to identify the problem, listen to the other person's point of view, avoid accusations and hostility, try to determine a way to resolve the problem in a cooperative manner, and put the agreed upon solution into action. If two people do not feel comfortable talking privately with each other, a mediator may be able to assist with finding a solution to the problem. Some facilities have grievance committees to assist with conflicts that occur. If a team is to meet its goals, conflict must be resolved, and you certainly don't want to act like the blue and orange guy and point fingers at each other. Leader responsibilities. Each team member must be aware of the legal limitations on duties that can be performed, and they must work within their legal boundaries. Effective teams are the result of hard work, patience, commitment, and practice. When each individual participates fully in a team and makes every effort to contribute to the team achieves success. Leadership for Section 4.6. Objectives are to identify 6 characteristics of leaders and to differentiate between democratic, laissez-faire, and autocratic leaders. Leadership is the skill or ability to encourage people to work together and do their best to achieve common goals. 2 different definitions of a leader is that they lead or guide others, and they are in charge or in command of others. Leaders are developed by their own efforts. It is a myth that people are born as leaders. It takes work to become a leader. Leaders define clear goals, share the goals with others in the group, help provide information and knowledge the group needs to work towards the goal. So they're not going to keep information hidden away or if they know something, not tell others about it, especially if it helps towards their common goals. They adapt or revise the goals based on the input of others, and they allow the group to achieve the goals. Anyone can be a leader by making an effort to understand the principles of leadership. Every member of a group who contributes is a leader. Leadership in groups pass from person to person as everyone contributes to the achievement of the group's goals. There are common characteristics of a leader, and all these characteristics can be learned. They are not inherited set of characteristics, they are learned. So one is to respect rights, dignity, opinions, and abilities of others, to understand the principles of democracy. They work with a group to guide the group towards a goal. They inspire and motivate others. They participate in continuing education and professional development and understand the concept of lifelong learning. They understand their own strengths and weaknesses. They display self-confidence and willingness to work and complete tasks. You definitely want a leader who is confident, who is willing to do the work and not just give out orders. Leaders communicate effectively and verbalize ideas clearly. Leaders show self-initiative. They show a willingness to work and to complete tasks. They show optimism, is open-minded, and can compromise. They praise others and give credit to others when it's due. There are different categories of leaders, and some examples are religious, political, club or organizational, business, community, expertise in a particular area, or even informal or peer groups. So you may have like a club or organization, maybe FFA or 4-H. You usually have a president who would be considered a leader, and then you also have the adult leaders. Leaders in these categories are developed based on their involvement in an activity. An individual who joins a club or an organization may become a leader when the group elects the individual to an office or position of leadership within the group. There are also different types of leaders. One is a democratic leader. They encourage participation of all individuals in decisions that have to be made or problems that have to be solved. They listen to opinions of others and base decisions on what is best for the group overall. They guide the individuals to a solution so the group can take responsibility for the decision. There's also the laissez-faire leader, and they are more of an informal type of leader. They strive for minimal rules or regulations. They allow the individuals in a group to function in an independent manner, has a hands-off policy and make decisions only when forced to do so. The term laissez-faire comes from a French idiom meaning to let alone. And then there's the autocratic leader, which is often called a dictator. They maintain total rule, they make all decisions, and has difficulty delegating or sharing duties. They seldom ask opinions of others. They emphasize discipline and expect others to follow directions at all times. Individuals follow this leader because of fear of punishment, or an extreme loyalty. Sometimes leaders are considered to be charismatic or non-charismatic. Charismatic leaders have a vision of a course of action, are opposed to the status quo and attempt to change it. They have the ability to build confidence and inspire others, are willing to use unconventional methods to achieve the desired change. They have a strong, self-confident personality that allows them to influence others, convince them that the leader's vision is the best solution to this situation. A non-charismatic leader is they're satisfied with the status quo, they resist change, they discourage the opinions of others, they stress why the current situation is the best solution, and then there's also leaders who are transformational, transactional, and stewardship. So a transformational leader, they want to change the current situation, so they stress what is wrong and provide a vision of what a new plan of action could do. Visionaries who see themselves as agents of change. They are often described as inspirational, influential, articulate, and charismatic. They readily state goals that must be obtained. They encourage others to shift their focus from self-interest to collective interest. They believe in people and show sensitivity to their needs, and they encourage teamwork and commitment to shared goals to create significant change while also encouraging each person to fulfill his or her own potential. A transactional leader, they prefer to maintain stability in an organization by catering to the self-interest of others. They are often described as task-oriented. They focus on defining roles and requirements. They want others to obey the commands of the leader and accept the status quo. They motivate others by rewards and punishment based on their performance. They reward others if they are successful in assigned tasks, and they recommend or punish others if they fail assigned tasks. They tend to discourage creativity, so followers may be prevented from achieving their full potential. A stewardship leader concentrates on serving the needs of others rather than the self-interest of obtaining power and control over others. They empower others to make decisions and grow personally and professionally. They emphasize respect, honesty, patience, kindness, and commitment to encourage others to share the responsibilities for achieving a goal. They listen carefully to opinions of others and work with them to formulate goals and strategies to solve a problem or find the best course of action. They serve as a negotiator or a support agent rather than a commander or authority agent. So in summary, all types of leaderships have advantages and disadvantages. In rare situations, an autocratic leader may be beneficial. Democratic or transformational leaders are usually presented as most effective for group interactions. Respecting the rights and opinions of others is an important guide for a leader.